Cian Corla, I welcome the opportunity to update the House on Ireland's COVID-19 vaccination programme. There's been a lot of progress since we last met. We hit the milestone of 1 million vaccines administered and moved on from that. We're now at more than 1.2 million vaccines. The vast majority of those living and working in long-term residential care have been fully vaccinated. First vaccine doses for healthcare workers have been substantially completed. Ireland is one of only a handful of EU countries that has achieved this. Ireland is leading the European Union in prioritising and vaccinating those over 80 years of age. The majority of people aged over 70 have now had at least their first vaccine dose, and around 95% of this group will be covered by the end of this week. More and more vaccination centres are opening. Next week, 28 of the total 38 centres will be open. Recruitment continues for the vaccination centres. For April and May, we now have a lot more vaccinators ready to go than are needed, with recruitment continuing for June onwards. The online registration system is going strong. It opened last week for those aged 65 to 69. By last night, a very encouraging 83% of people in this age group had registered, and vaccinations for this group started earlier this week. Tomorrow, the online registration system opens for those aged 60 to 64, which is another important step. Vaccinations are moving at pace for those with underlying conditions that put them at very high risk from COVID-19. More than 100,000 people in this group have now had their first vaccination dose. It's fair to say that we've had a busy few weeks. What's really encouraging is the impact the vaccination programme is having, which is nothing short of astonishing. We have the lowest level of COVID hospitalisations in a long time. From January to last week, there has been a 98% reduction in COVID cases for healthcare workers, a 99% reduction for those aged over 85, and a 100% reduction for nursing homes. Given all of this, it's not surprising that public confidence in the vaccine programme is strong. 9 in every 10 people are saying that they will take a vaccine when they're offered one. I'd like to thank the thousands of women and men all over Ireland who are making this programme work. It's not easy. Last week we had to adjust to major changes for AstraZeneca, Johnson & Johnson and Pfizer vaccines while keeping the programme running. Right now we're waiting on further advice from NIAC on Johnson & Johnson. In the past week alone, we've had changes to the delivery schedules for every vaccine for nearly every week. In spite of this, vaccination centres are opening. General practice is running the vaccination programme at full speed. Online registration opened and is expanding. And critically, people are getting vaccinated at the pace we're getting the vaccines into the country. So thank you to everyone working in general practice. Thank you to everyone working in our vaccination centres. Thank you to the Defence Forces and our vaccination teams in hospitals and communities. Thank you to everyone working in long-term residential care and in disability services. Thank you to the National Ambulance Service. Thank you to everyone working in the voluntary sector involved in this programme, and to everyone else working so hard around Ireland to make Ireland's vaccination programme a success, to make sure we protect the most vulnerable and that we have a path out of this pandemic. The benefits of vaccination have put the government in the position where we can continue to carefully open up. Thanks to an all-Ireland effort, we're ahead of the best-case scenario presented just a few weeks ago. The R number remains below 1, and the number of close contacts has remained steady at 2.6. This is a huge achievement for Ireland, particularly given the prevalence of the B117 variant. It has only been possible because of the continued solidarity right across the country and the day-to-day efforts of every person, every family, every community. The recent decline in incidence of the disease across all age groups has happened through our joint efforts, contributing to the protection of our loved ones and of our communities. Because of these efforts to suppress the virus at home, Ireland now has one of the lowest rates of COVID in Europe. We also have the strongest measures in place against variants coming into the country. And we have a vaccine programme which is consistently performing among the best in Europe. The plan is working and great progress is being made. To protect it, we still need to proceed carefully. Social interactions are on the rise. We can all see it. GP referrals for COVID testing have increased this week. The number of daily cases is still higher than any of us want. If we open up carefully, if we stick to the public health measures, if we make sure enough people are vaccinated, then we can look forward to what we all want, a good summer with our friends and with our families. I'd like to briefly address specific issues now relating to specific vaccines. Safety is a cornerstone of the vaccination programme, and colleagues will be familiar with the recent advice from the European Medicines Agency, the EMA, and the National Immunisation Advisory Committee, NIAC, in relation to AstraZeneca. The EMA has added unusual clotting events with low platelet counts as very rare side effects to the vaccine product information for AstraZeneca and recommended the same for Janssen. The EMA has been in regular contact with its American counterpart. The European Commission's Vaccine Steering Board, which oversees the procurement of vaccines on behalf of Member States, has been kept apprised of developments during the course of all of these deliberations. The EMA completed its review on the 20th of April, recommending that the product information for the vaccine should be updated to refer to possible but very rare side effects of these blood clots. The EMA has also said it's very important to say that the overall benefits do outweigh the risks. NIAC weighed the advice carefully by the EMA on AstraZeneca. NIAC has recommended that AstraZeneca can be used for all of those aged 60 and above. NIAC has also recommended that everyone who has had a first dose of AstraZeneca should have their second dose of AstraZeneca. This applies to all age groups. The interval for those under 60 is 16 weeks, except for those who have an underlying condition that puts them at high or very high risk from COVID. For that group, the recommended interval from NIAC is 12 weeks. As colleagues will be aware, NIAC is currently considering the EMA's recent position on the Johnson & Johnson vaccine, and I expect a recommendation early next week from NIAC on that. The European Commission has also successfully concluded an agreement with Pfizer to accelerate deliveries into April, May and June. This means that more than 500,000 additional Pfizer vaccines will be in Ireland in the coming months, which is very, very welcome news. Notwithstanding the range of vaccines currently authorised or in various levels of production and testing, there is a need to consider the future trajectory of COVID-19 and the measures required to address it. The degree of protection provided by the various vaccines is being monitored closely. However, it is likely that further rounds of vaccinations will be needed next year. In conjunction with this, it is evident that the disease is evolving such that a range of variants of differing severity and infectiousness have already been detected. To this end, plans are being advanced by the European Commission for future procurement of vaccines. The Commission has recently commenced negotiations with Pfizer-BioNTech with a view to securing a new agreement on behalf of Member States. This agreement is for the delivery of 900 million doses of a reconfigured version of their vaccines. It is across Member States over a 2-year period and indeed is very, very welcome indeed. If our collective experience of COVID-19 has taught us anything, it's that we need to be flexible and adaptable. The disease continues to evolve, and our response to the disease must continue to evolve as well. This applies to testing, to tracing, to genome sequencing, to rapid testing, home quarantining, hotel quarantining, public health measures, and of course, as the last few weeks in particular have demonstrated, the need for adaptability applies all the time to our vaccination programme. The last few weeks have been particularly busy as we incorporated several very big changes, from NIAC advice on AstraZeneca to action taken by Johnson & Johnson in terms of the delivery of their vaccine into the EU, to the very welcome news of over 500,000 additional Pfizer vaccines for April, May and June. I have no doubt but that changes like this are going to continue to happen every month, possibly every week. Changes like this are going to keep coming at us. we've got to continue to adapt to make sure that safety, as always, is a cornerstone of our vaccination programme, and that we meet our core target, which is that people are vaccinated at the pace that vaccines are coming into the country. Thank you, Ceann Comhairle.